This is the Lone Crater YouTube. We hope this video helps.
You start by preparing the clip and teeth. This is crucial. First, use a soft brush and mild soap to remove debris, then rinse completely. Once dry, inspect the clip for bends or cracks. Correct minor bends with gentle pressure. Now position the clip on the front teeth, align it to the gum line, and press evenly until it seats. You should feel uniform contact. If one side sits higher, stop and reseat it before moving on. Once the clip is seated, verify the fit by taking a gentle bite. This tells you whether contact is even. If you feel a pressure point, remove the clip and make tiny adjustments using padded pliers. Small, incremental moves prevent damage. After adjusting, reseat and bite again to confirm. If edges rub, apply a small piece of dental wax to the area to protect soft tissue. Stay patient. Fine-tuning now avoids soreness later and keeps the clip. To finish, establish a maintenance routine. Clean the clip daily with non-abrasive paste and warm water, then store it in a ventilated case overnight. Make sure you inspect for wear each week. Replace the clip if wires separate or plastic cracks. If the clip feels loose or causes persistent pain, discontinue use immediately and see your dentist for professional repair rather than forcing fixes at home. One key tip: if irritation occurs, pause use and consult a dentist to avoid damage.
Thanks for watching. Consider subscribing if we helped you.